Work rounds are about to begin. The team assembles in the hospital corridor outside the patient's room. The intern and junior resident are already here, and the senior resident is about to arrive, bringing with him a new medical student. He introduces the medical student in a very friendly and informal manner, and then proceeds to explain how rounds will work.
The team, we're going to round on all of our patients, and you just feel free to jump in with any questions, okay? Don't be shy.
Thanks.
All right? Because she can send me my 2 interns for the month. All right? So we have a new admission.
We have a new admission, Miss Smith.
The junior resident begins presenting the patient. Patient presentations are presented in a way that includes all critical information and generally follow a typical format.
A new right middle lobe infiltrate.
Right.
And she was started on ceftriaxone and azithromycin and admitted to step down. She was in
It's a step down.
The senior resident interrupts to question the patient's admission to the step-down unit. This is a term that is specific to this hospital, and terms like this will have to be learned for the hospital that you are in.
Rest of her labs were normal, night floats and blood cultures, the urine antigens. She doesn't really have any history, like significant past medical history or social history. She says that she has a family history of breast cancer in her mother at the age of 52. She's married, does not have kids, no smoking, no drugs, no alcohol.
Right.
As the presentation is completed, the senior resident begins the teaching portion of the rounds by posing a question to the medical student. When she cannot answer, the question goes to the intern and then to the senior resident.
She can.
That's okay.
So you could give azithromycin for it. No?
Right, exactly. So the empirical treatment of community-acquired pneumonia usually includes treatment of Legionella.
Azithromycin.
So the Zithromax that she's on would cover Legionella.
Oh, perfect.
A lively discussion regarding the choice of antibiotics has ensued, and there is a lot of give and take between the residents and the medical student.
Then you know the diagnosis, right? But do you know what the sensitivity is of that test?
I know it's really poor. I don't know the exact numbers.
Notice that the intern has taken some reference material out of his pocket. It's common for interns and other residents to carry material like this in their pockets, and it's completely appropriate to take them out and refer to them during rounds.
Diagnosis.
Right. And you also
Right.
give azithromycin to cover for atypicals like mycoplasmas.
Yeah. Okay.
I think we should test her for HIV too because she's young and she presents with such a bad pneumonia.
Right. Has she ever been tested before?
Not that I know of.
I asked her, but she denied it.
She denied having been tested or having
No.
HIV?
She said that she was tested, but it was negative.
Oh,
Note that while the team was discussing the appropriateness of HIV testing in this patient, there was some confusion on the part of the intern. But note that he is not held accountable for this error, but the team sees the humor in the situation and moves on.
She
Right.
says she's still short of breath. She's coughing out yellow stuff. But she says she's slightly improved than yesterday.
okay. Do you know if a sputum sample was sent?
I think, let me look it up.
Look it up. But should we do a sputum sample in pneumonia
The
patients?
senior resident asked some questions about the patient's course and what laboratory tests have been ordered. He uses the topic of sputum samples to engage in a discussion regarding guidelines.
Erica?
I can give it to you if you want.
Yeah, that would be
You can
great.
cheat.
I can read.
You can cheat.
And you can see what the recommendations are regarding sputum sampling and blood culture. All right, and in terms of her labs, she was a little hyponatremic.
133.
Right.
Yeah. She had a white count, 14.3, but rest everything was okay.
Okay, so she's pretty stable, not very hypoxic.
It is time to go and see the patient.
All right, let's see her.
Sure, let's go.
Don't forget to wash your hands.
The senior resident reminds everyone to wash their hands as they enter the room, and all the team members are introduced to the patient.
Nice to meet you. This is
Hi, how
Dr.
was
Kim.
mine?
He's one of our interns, and this is student doctor Heather. She's part of the team as well.
Okay.
How are you feeling today?
I'm still short of breath.
The senior resident inquires how the patient is doing, and then begins explaining her medical problems and the plans for treatment.
Or something. I don't know why.
Right. There seems, you seem to have pneumonia, which is an infection in your lung, and that's what's making you sick, we believe, and that's the reason you're short of breath.
Oh. Okay.
So we're giving you antibiotics, which hopefully will make you better. Okay.
In here?
Right, through the IV. You're getting the antibiotics through the IV,
Okay.
and we're just running some tests and seeing if we can find what the cause is. Oftentimes we don't find the exact bug that's causing this, but I'm sure you'll probably respond to treatment really fast.
Okay.
Okay. Do you mind if I examine you real quick?
Yeah.
I just want to listen to your lungs.
With the patient's permission, the senior resident begins some relevant physical examination. Note that the medical student joins in spontaneously, and the junior resident is also invited to listen.
Can you cough for me? Can you say 99
99.
again?
99.
Yeah, sure.
Take deep breaths through your mouth. Now, go 99 again.
99.
Perfect.
99.
Yeah, I can some crackles.
I know that you have been tested for HIV before.
Mhm.
You had a test done because you're a blood donor, right?
Yeah.
A gallon.
After the physical examination, there is some discussion regarding HIV testing, and the patient is invited to ask questions which are then answered.
We want to make sure we rule everything
I
out.
understand.
Okay.
Mhm.
What other questions do you have for me?
Can you let my husband know?
That you're in the hospital?
Mhm.
Definitely. Do you have his number?
I
Yeah.
have the number.
You
I
have
can
it.
give him a call.
Okay. Good. Anything else? No.
I think that's it. How
Okay.
long do you think I'm gonna have to stay in the hospital?
Well, usually we want to wait until the fever is gone.
Oh
you
yeah,
know,
I still
and,
feel hot.
yeah, and we want to make sure you're feeling better, able to eat and drink, and once that happens, we'll probably switch you to oral antibiotics and let you go.
Okay.
Okay?
Mhm.
She was in February overnight.
Yeah, you still had a temperature, which is
Okay.
why we're kind of still watching you and we're still having on the IVs. Okay?
Okay.
All right. Well, I'll see you later. Okay?
Okay.
Any questions? Just feel free to ask, your nurse, and they'll let us know.
Okay.
Okay?
Thank you, doctor.
Did you eat
I had a little.
a little?
Yeah, I don't have much of an appetite.
Just as the team is finishing up, the patient's nurse enters the room.
Yes, she's my patient today.
All right.
Let me just fix this real quick.
All right. How's she doing
Okay,
overnight? She do okay?
She's doing well. You know, she still has a fever despite getting Tylenol
Right.
through the night.
Right.
But her oxygen requirements are going down. She
Right.
looks
The senior resident asks for and receives some very valuable information about the patient from the nurse.
2 liters. She was
2
on
liters?
4 overnight.
Okay, great. Has she been getting any NAP treatments?
Note that with the nurse's input, some areas that had not been previously discussed are now explored.
They make the shortness of breath better.
Okay, all right. Has she been out of bed at all?
No, she looked a little weak overnight, but we
Right.
can get her out of bed to the chair and see what she does.
Yeah, just to make sure she doesn't drop her blood pressure or feel funny.
Sure.
Right.
Sure.
Right. Okay. Good. Well, I'll see you later, okay?
Okay. Thank
All right.
you.
See
Nice
you
to
later,
meet you.
Ms. Smith. Nice.
After a courteous goodbye to the patient, the team leaves the room.
Michelle.
Sure.